So what are some examples of techniques you might apply that differ?
Well, as I was saying before, I use muscle response testing. I was fortunate to have some sessions with George Goodhart,
Oh,
with
me too. I
right,
love it.
yeah, with David Leaf, and
Hmm.
especially with Bill Makel up
Hmm.
in Auburn,
Yes.
who taught one of the 100-hour courses, and I took that,
Yeah.
and after I did that, I was able to do things I couldn't have done before with just intermittent exposure to that.
Right.
So that has been very helpful.
Yes.
I use various forms of tongue diagnosis
Right. Yep.
with more of a Chinese
Hmm.
perspective. I have picked up a lot of different little pieces along the way that kind of fill in so that I get information. I would say I get what we would call in medicine soft information in a number of different ways.
Right.
But when you smell smoke and you see a little flame, you may not put your hand in the fire,
Sure.
but you begin to say, I think there's fire there.
This one.
So,
There you go. Perfect.
so all that, putting all these different things together,
Hmm.
and always there's more. With functional medicine, I was with Jeff Bland 30 years ago,
Great.
and
Great man.
yeah, so I've been following that, and now I have an assistant who's studying Ayurvedic medicine.
Hmm.
So we bring that perspective in. Each thing gives you a little twist that helps you better point a person in a direction that's going to be better for them in
Right.
subtle ways. Like a lot of people with skin disease, they're more vata, they're more airy, and
Yeah.
they need to be more grounded. And they might be eating raw food, and that's not good for them. They might need to have cooked food instead, if they're more vata.
For
So
sure.
all of these little perspectives add together to give a greater whole.
Great. That's great. So insightful.